Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Payne, Chief Medical Officer and founder of Atlantic Coast Aesthetics. And Dr. Payne, we have a question from, it looks like, the Twitter crowd this week. And we have this lady who tweeted us, what can I expect for a breast implant removal surgery? Dr. Payne, maybe you can shed some light on this question?
Well, it's a good question because breast implants are not lifetime devices. We don't always point this out to people, but it's important to keep it in mind that the implant may not give you the kind of results you're looking for over many years. Most of the time, that's because of something that changes with your body. So you either have weight gain and loss or pregnancy, something like that. The implants usually work pretty well, but sometimes they become deflated. And if they're saline implants, you'll notice that because the breast will go flat. When people talk about an implant removal, and sometimes they'll say, look, I just want the implants out, I don't want implants anymore. No problem. That is fine. The thing to keep in mind is what's going to happen to the breast tissue that's left behind. Because the implant does have a thinning effect on the rest of the tissue. And sometimes people just want the implants out, no problem. But in the majority of cases, especially if there's a lot of thinning of the tissue, you might have to do a breast lift at the same time to get the breast shaped properly, if it looks like there's going to be too much thinning of the tissue. Again, it's not required to do it at the same time, but the recommendation has to be based on taking a look at what's going on with the tissue in your individual case. Most of the time it's going to be helpful, but not in all cases. If it's a small implant that was placed and the tissue is pretty thick, then you may not need anything done at all. Alternately, you could just have the implants removed, see how things go, and if you decide you want the breasts shaped differently, a breast lift procedure could be done at a later time. The recovery is pretty easy. It is not a painful procedure. It's the implants going in and under the muscle that tends to be more sore. Removing them, not really a big deal. And in some cases, if there's no breast lift or anything like that, it can be done under local anesthesia in a short procedure, sometimes in the office. So hope that covers it, and best of luck.
Well, thank you, Dr. Payne. And if you have a question for the doctor, please reach out to us on Facebook or our website or by using the link below. And Dr. Payne, we'll see you on the next question.
Great.